at this point, social media is a big thing, right? And we're always apt to just have a response right then or have an opinion about everything. But I think if you can take feedback and really study it, take notes when someone gives you something good or bad, whether that's just through a conversation or annual review or compliment even, and then investigate that a little bit. Again, be curious about what led them to, say that to you. And self-reflection, I think, is a big deal on that. I think that's the key to it, right? Is having the ability to self-reflect and then not always form what you think is the opinion or close doors necessarily, close your mind to things, because it's important that you stay open-minded to it, because you don't know what that leads to for sure.
Hello, everyone, and welcome back to another episode of the PTA Plus podcast. I'm Katie Sutton, your host, and today's guest is Leah Voorhees. Leah is a physical therapist assistant with over a decade's worth of experience. However, she uses her PTA skills to lead others as a director of therapy. In this unique role, which includes things like compliance, staffing incentives, metrics, leading regions, a student program, and a medical review team. So she's got her hands into a lot of different things. We dive into topics such as mentorship, leadership, what student programs look like, and so much more. I know that you're going to find a lot of value in what Leah has to say. So without further ado, enjoy the show. And as always, thank you for listening. Hi, Leah. Welcome to the show. How are you? I'm good. It's so nice to have you join us today. I'm always really excited when people say yes to coming on to the show when I've never actually met them or anything like that. So kudos to you and everybody else who always says yes and is willing to come on and tell us a little bit about your story. So you are once again somebody that I met on LinkedIn. So I don't get paid by LinkedIn to mention their name a bunch, but it seems like I do get a lot of podcast guests and connections and friends that I'm meeting through LinkedIn these days, because it's just such a powerful place. I mean, there's just a lot happening on there.
A lot. Yeah, it's a lot, isn't it? I think it's the professional social media for sure, across all disciplines, not just therapy. So it's exciting to see that healthcare has come on the page and seems to utilize it in a huge way. So that's always exciting. So great to make the connection.
Yeah, absolutely. And I was just telling you before we hit the record button, I'm always excited to see the things that you share because, and as we're going to get into, you run a huge team, but there's always fun things that are happening in the facilities that are part of your company Step Up. And I just get kind of like engrossed in what they're doing. And I'm like, oh, look how fun that is. You're always doing all these fun activities and all kinds of things. So I don't know how you do it, but
A big team. Kudos to my team.
yes,
All of us for
absolutely.
sure. Hmm.
So you are a physical therapist assistant, and you have been a physical therapist assistant for a while. So
Hmm.
I'm just going to kind of let you go ahead and jump in and talk a little bit about your background, because the reason why I reached out to you is because you are really challenging the status quo of what a physical therapist assistant is and what the typical role is for a physical therapist assistant. So that's why I reached out to you. I'm like, hey, you're doing awesome things. I want to talk to you. We must be friends. and,
We
and you said
must.
yes. So if you don't mind, can you kind of give us a little bit of background? Like, how did we get from you became a PTA to you overseeing 20 some facilities or therapy teams?
Sure. So got my start at Gulf Coast State College back in the day when it was still a community college. So shout out to the class of 2009 there. So started there, and my last rotation was in skilled nursing, and not something I had really considered when I went into the PTA program. I wanted to do pediatrics. I think a lot of PTAs go into it for that, and wanted to do hippotherapy, which is equine. And the
Mhm.
same year that I got accepted in 2007 to the program, Medicare stopped reimbursing for equine and animal therapy. So that was kind of a bummer, and just kind of changed the trajectory of what I thought I wanted to do with my career. So came out of school and did some outpatient and SNF work. And then as years went on in 2011, found myself in SNF care, moved into assistant DOR role with a clinician that I worked who was mentoring me at the time and was my DOR. Shout out to Brannigan Keller. So she's a PT and just encouraged me. She was like, you love the leadership, you love the team building, you love the team setting, which I did. I find in SNF that, you can have that team collaboration both inside and outside of the facility and community outreach and see patients come full circle, just inpatient stay and outpatient. So I liked that. And then it developed from there. Got involved in some bigger companies, made some moves, and became a director of rehab and relocating to Panama City, Florida. And from there, went to work for a company that did startups and acquisitions. So they would get new contracts, and I would help bring those new teams on. And that really introduced me to the wide world of management for a PTA. And then from there, I came over to Step Up Rehab. I've been with the company itself, Infinite Care, for 2 years as of last week, and I stepped into the director of therapy role after being a regional for them this past February. So really excited to move into that, but that's kind of the backstory in short.
Yeah, director of therapy. That's an interesting title. But what I don't think that is captured in that little DOT is what you said, like, or
Mm-hmm.
director of therapy, is all of the things that you do. So, and we're going to break this down a little bit, but I think it was interesting that you mentioned that you wanted to go into hippotherapy and pediatrics at first.
Mm-hmm.
I have done a little bit of volunteer work in hippotherapy, and
Mm-hmm.
it's a great experience. If you're not familiar with it, um, go check it out. You don't
Mm-hmm.
have to like have horse knowledge to do it, but I
Right.
mean, I think a lot of people are attracted to it because of that. If you are someone who has been a previous writer or whatnot, but yeah, it's a great thing. I did treat pediatrics for a little bit, but I always joke and say that I kind of did it kicking and screaming because I never really thought I was like built to do that, you know? We all find those things that we're really good at. And it was one of those things that I was like, yeah, I think I gave good care, but I
Mm-hmm.
just don't know if I was, plugged in enough to feel like I did a great job. So
Right.
did it for a little bit, but now you're in skilled nursing. And what I always find interesting is that students will come into the profession just driven to do, sports or outpatient, or they're just like ready to take on the world, pediatrics, like you said. And then they go through a clinical experience with a skilled nursing and they're like, I love this. This is what I want to do. And I'm just so happy. It makes my heart happy because I know that we need those caregivers in that setting. It's such an important role.
For
So
sure.
I appreciate what you do. I know you do work a lot with students too,
Mm-hmm.
but you, again, this director of therapy role that you have, some of the things that you told me are staffing initiatives,
Mm-hmm.
metrics. You manage regional leaders. There's compliance that are involved in this. You are really responsible for kind of starting in this little like I shouldn't say little, a student program, a clinical education program like that just kind of came from you pushing a little bit towards that,
Mm-hmm.
right?
Yeah.
So there's all these different things that you do. So how did that unfold? Like, how did you know that
Mm-hmm.
you were really built for leadership versus traditional clinic work?
I don't really say that, you're built for it. I think my mom primed me very well. She was an ALF administrator when I was growing up, so I grew up running the halls. So you get that exposure to geriatric care. And then I loved animals, so that kind of drove me to the equine, field of it. So I was like, oh, this could be something fun that I could intertwine, and still have kids because in a lot of ways, geriatrics and pediatrics do mirror each other. You get to use a lot of the same skills if we're realistic about it. So I think the approach is something that I loved about it. But in developing that, I think just a call to from mentors, different mentors as I was going through school. I did a SNF rotation. It was my last rotation, but my first two rotations were outpatient and pediatrics. And that last rotation, just having mentors say, hey, I think you should really consider skilled nursing facilities. I'm like, oh, I'll get, a PRN job. So that was my first PRN job coming out of school. Then I went to outpatient for a little bit and just found my way back to it. I don't know what the calling is. It's just each position that I went into, I was always called to do a little bit something extra, or I asked for something extra, because I just saw deficits. So I think sometimes we're built to see problems and then tackle them or offer solutions, and people are always welcome to that in healthcare. One more hand is always helpful, as I say. So I think that's really where it comes from, just being encouraged by others and then seeking out opportunities myself.
Yeah, absolutely. Was there anybody who kind of challenged you, or was there ever a moment where you were like, well, I'm a PTA, so I don't know that I have the right skill set for this or anything like that? Like, was there ever a moment that you questioned that?
Yeah, I think transitioning from that ADR role to a director of rehab role, that was a big jump because it required a relocation, and just really challenged me to say, okay, is this something that I really need to go back to school and get a DPT for, which I entertained a little bit, or can I do this without it? And I found that as I made my way through some of those positions in my first EOR position, getting into more of an area manager and regional role, that it didn't require it. I think early in my career, let's just say those 2010, 2015 era, it really did. Most companies only hired regionals who had that master's level or above degree. And then we saw that shift as we got closer to COVID, and things. So I think that opened up the door some, and I was willing to always go. I will say that I've traveled insane amounts of airplanes and miles in a week, and done multiple states in a week. And I just loved that. I don't know, maybe it's the gypsy soul in me that just kind of
Mhm.
loved that challenge and meeting new people. And it was always it may be the same setting, but every facility and team are different.
Yeah. So a little bit about Step Up Rehab. Like
Mhm.
this isn't just based in Florida. Like there's multiple places. So this is why you're racking up those miles, right?
Right. So Step Up Rehab is just in Florida, but then under the Infinite Care umbrella for the same entity, we have buildings in New York and New Jersey. So that allows us to travel. And my prior
Mhm.
companies were multi-state. I've done Texas, all of the Southeast, all over, and then up into
Mhm.
Virginia and West Virginia, and did some Ohio and Illinois. So those are exciting too. But my Florida self came home quickly in the snow. It was not for
Yeah.
me.
Yeah, you spend a little bit of time here in Ohio, and you're gonna go back
Yeah,
to.
yeah, yeah.
As
I
a
was
matter of
ready to
fact,
come home.
most of Ohioans go to Florida.
Yes,
Usually between November and March, they're there. So,
yeah, for sure.
so what kind of preparation do you feel um, would be essential for someone who's looking to make this shift, or did you find to be very helpful to you? Because you mentioned you considered going back for your DPT, but you
Hmm.
found that it wasn't necessary, not for
Hmm.
that leadership type of role. But were there other things that you found that were helpful to kind of prepare yourself, or trainings that you've looked into that might be really helpful for somebody thinking about making that kind of a change?
Sure. I think a lot of it is figuring out what the organizations are around you. APTA is a big deal. And then finding mentors in community. You have to find the right PTs who are willing, and even other disciplines. Like I was very open to other mentors and disciplines. I think that's the great thing about SNF, right? Is sometimes your
Mhm.
directors of rehab or your area managers, regional managers, all up into the president level, they're all different disciplines. So it was multifaceted. So I think not being scared to go to them and ask questions, engage with them and ask them for leadership points, or as you go through annual reviews, you learn more about yourself and this career path. And I think sometimes just being challenged by mentors and engaging with the people that I respected and being open minded to what they suggested or encouraged. And I have done a couple of certifications. I've done the Dolphin NPS for some neuro. I've done kinesiotaping and things like that I could use in any setting. So I think that diversifying yourself in certifications that allow you to tackle any setting again. We know that can be used in sports. We can use it in acute care. We can use it in SNF care, pediatrics, all of those things. I think those certifications that fit into a broad range of paths open you up to so many possibilities until you find your niche, for sure.
Yeah, I think it's interesting you mentioned getting yourself near people whom you want to kind of emulate their work. And that's kind of been really, I think, like the topic or the theme of this summer
Mm-hmm.
for most of the podcasts that I've either recorded or that have already been released is just kind of getting yourself near what it is that you might want to do or that you might
Mm-hmm.
like to do. So you said that you kind of like grew up roaming the halls of nursing homes. So it was very familiar to you, right? But whenever you decided to kind of make those leaps and transitions, you were surrounded by people who were mentoring you. But when people are mentoring you, they're able to easily identify your strengths, sometimes a little bit quicker than you can identify them yourself. So by getting yourself close to those people, you're getting yourself close to that profession or that work. And then you're determining, am I good at this? And is this something I can get paid for? And you're kind of like making all those steps to kind of see, like, is this what I want to do for the rest of my life, right?
Hmm. For sure.
So because you have been in skilled nursing for so long, what do you think it is that keeps you passionate about that setting?
I think it's a couple of different things. You mentioned my student program. I'm passionate about, capturing PTAs out of school and encouraging them to use, straight out of school. I will say the SNF sector allows you to use everything that you learn in school. You're not just working with geriatrics, you're working with
Mhm.
geriatrics who have neuro involvement, who require wheelchair positioning and mobility. You're working with amputees, you're working in some younger athletics. There's so many opportunities in veterans' homes and just diverse long-term care settings that I think is great for a student. And then I think from there, it really is just building upon and finding communities and networking, like how you and I met, that were able to loop me in and say, you know what, I enjoy both the operations and metrics. I'm not going to say I love math because I don't, but I love the challenge of how do I get to a benchmark or how do I get to, my team to operate in a level that is efficient and optimal and ever changing, as we know about healthcare and billing. And then I really, really enjoyed just the education side of it. I think that that's what draws me in and motivates me every day to just make sure that our clinical teams are well versed and prepared for what they're going to be challenged with every day. And if they need a resource, what can we do to build upon that and be available to them and challenge them to not just deliver status quo care, but do something that they're passionate about and keeps their heart on fire? Because let's face it, that's how we prevent burnout.
You know what? It's so interesting that you mentioned that. That's like the perfect segue because the next thing I was going to kind of ask you about was burnout and ways
Mhm.
that you have found are helpful for you to work with your team to really keep that energy up and keep yourself motivated. Skilled nursing can be heavy sometimes, so
Yes, it can.
like what are some of the things that you find help build that connection, build that team?
Mhm.
I know you're constantly working on it.
I think a lot of it is self reflection. Like, what are the things that motivate me and helped me throughout my career? Sometimes it's that patient who took that extra 15 feet or transitioned to ALF care or whatever it is. So I think, just really highlighting the things and sharing with my colleagues, the successes of the week and the challenges of each week. But you and I talked privately off screen too about just, I'm not naturally, super outgoing, so I'm a bit of an introvert. It's just me and my husband, no kids. So I enjoy like beach time and being quiet. And I think those are some of the best moments that I have, just reading and engaging in leadership, different books and things like that. Just challenging myself kind of helps me rebound to be the best for my team every day.
Yeah, any great book suggestions? I know that was not like something that you and I
Oof.
talked about, but anything you've read recently that you found to be helpful or insightful?
I'm one of those people that has 3 or 4 books going on at one time.
Me too. I have so many started.
Yeah. So I can send you a list, right? But I think that just
Yeah.
not being afraid to search things out outside of healthcare. I think that's been big for me. Looking at different
I like it.
leadership roles and,
Mhm,
following CEOs and different things who have
mhm.
written things. I just enjoy capturing someone else's perspective and how does that flow over to healthcare? How does it flow over to the back end of my operations team? Like you mentioned, being involved in student affiliations and universities, our recruiting team, our staffing team, all of those different things. What does that look like? Leading and communicating and knowing, learning how and knowing how to communicate with all those different levels of people.
Yeah, unfortunately, I have an unhealthy amount of books that I have started myself, but I've been reading the Let Them
Okay.
book by
Hmm.
Mel
Hmm.
Robbins. So I'm about halfway through that one, but I have a whole slew of things that are like ready to rock and roll. I mean, you and I could probably just do an entire show about some of
We can
the
just do
books that
it.
we have found to be helpful because I agree, like
Sure.
the majority of the stuff that I read has nothing to do with healthcare.
Correct.
I mean, it might be very connected, but I think as long as you're continuing to build your knowledge and all of that, like it can all transition in some way, shape, or form, right?
Hmm. Absolutely.
So let's talk more about this clinical instructor and student program that you have going on here, because this is interesting. I find it very crucial.
Hmm.
Myself, I work in PTA education. My full time day job, I like to say, is in clinical education. So that's what I do is I work with students and I get them placed and all of that good stuff that goes with it. I say that in like a 5 second time frame, but you know all too
Hmm.
well that it takes months to get students placed, and it takes time for them to get through their clinical, and then there's onboarding and all of these things. So tell me, why was it really important to you to get a student program up and running at Step Up?
I think my background at my first DOR position, I was still close to Gulf Coast Community College. It was very close to that college, so having resources there and still being able to stay connected to my alumni team, and it was something I carried over with me to different regional positions. Then when I came to Step Up, Jennifer Marks was our DOT at the time, and she's an SLP and completely, I mean, she's so passionate about student programming. So when she brought that to the forefront, I was like, I will take this and run with it all day. So she laid the groundwork for it. And then as I transitioned to this role in February, we've just continued over the last 2 years to really build upon that. We're almost up to, I think, 25 universities now. I signed 2 more
Wow.
affiliation agreements today. So it's exciting to be from Florida, but be involved with universities not only in the state of Florida, but all over. And I think that we see the criticality of there are fewer and fewer programs out there, especially since COVID. And then we're seeing that our industry just does have, a need as the baby boomers age. We have
Mhm.
more people that we need to take care of, right? Especially in geriatrics. So you have an aging population and not enough staff to go around. So how do we capture those students straight out of school or while they're still in school and lay the groundwork for them to go
Mhm.
to clinical rotations like you and I manage so closely? And that's how, you and I kind of connected. And I was like, oh, I love this. Me and Katie are going to hit it off. So I was glad when you reached out. But I think just being involved with universities and being involved with APTA and other different organizations, it's just become so important to get in front of those students and say, hey, this is what you need to do in your career. There are so many opportunities, but you got to keep yourself engaged to prevent burnout because healthcare is
Mhm.
heavy. And starting that off the bat just to so everybody has a healthy understanding of what to expect in the career path.
Yeah, definitely. So, what do you think, or what are ways that you try to prepare someone to be a clinical instructor? Because it's not something that you just it's not like we learn how to be a clinical instructor as a student. Now, I think that we have the models that we had from the clinical instructors that were ours,
Mm-hmm.
which sometimes are great models and sometimes are not great models. And I always tell students you can learn something no matter if you have a fabulous experience or one that was like maybe not, your favorite kind of thing. But what do you think makes a good clinical instructor?
I look for personalities that can either, I think, really connect with their patients. That's a big deal, right? Because if you can connect with your patients over and over again, multitudes of people throughout the day, then they're going to easily connect with a student and they're going to be able to break down what they do. I think I'm always very open to someone who is a year out from school versus someone who's been in the career path for 20 years. If they naturally like to teach and engage, whether that be their patients in the SNF community, ALF, ILF that we have at some of our campuses, whatever that is, I'm looking for someone who takes that initiative to do some type of education at the patient level or at the facility level, and then watch them kind of blossom and say, hey, have you ever thought about, welcoming a student and being a clinical instructor? Or they come to us, they're like, I'm so ready for this. I had great instructors or I didn't. And I want to lay the groundwork for someone else to be, welcomed on and come into the career path and know that this is an opportunity.
And sometimes that's the driver behind it. When you said that they'll say that either I had a great clinical instructor and I want to be able to
Mhm.
give this back as well, or they'll say, you know what, I didn't have a good clinical experience. I didn't have a great experience within that time frame. So I want to be able to do this and show something different to a student. So
Mhm.
unfortunately, I mean, it happens. And sometimes that could be a personality thing as well. It might not necessarily mean that it's a bad student or a bad clinical instructor. A lot of times we just have environments that maybe are not right for each other, right? So do you secretly deep down hope that all students fall in love with skilled nursing?
Every one of them. I hope every
Everyone.
one of them fall for it because it is so diverse. You can come in, like I said, I spoke a moment ago about some of our campuses having ALF and ILF care. What a blessing to be able to see them for a continuum of care. Maybe they come in and they're not going to be able to completely rehab home from short-term care, and they need to be placed in ILF and ALF, so assisted living and independent living. Having those sectors on campus and being able to follow their progress or be a part of that, I think is amazing and makes it roundhouse. And then some of them go home and do home health, and then they circle back to us for outpatient as well. So it really is a setting where you can capture so much and use all of those skills again that you get in school without coming out and just being so hyper focused on just pediatrics or just athletics. You can do a little bit of it all, and you'd be surprised what comes to a sniff for outpatient for sure.
Yeah, that's very interesting. I guess these are obviously things that I know, but if you're really looking to kind of um, keep using all of your skills, right?
Hmm.
Keep them
Hmm.
all up to date. I mean, skilled nursing, especially in the type of company that you're working for, seems to have all of those components that you can really kind of keep that skill going,
Hmm.
all the time, so that you don't feel like you're getting rusty in one specific area or not, because you truly can see like the whole gamut, right?
Yeah, absolutely. You can see everything. And I think modalities get lost in that. We come out of school and it's the one setting that we use. You can use a lot of modalities. So you pair up with a team and, a supervising PT who's very passionate about modalities, and you can learn so much and have such amazing results in SNF care because you can have that one-on-one care, or they can have group and concurrent opportunities where they're going to see other patients succeed, and that motivates them. We don't always get that opportunity in home health or an outpatient. But when they live alongside someone, either for short or long term rehab, and get to see them progress, it motivates them. And then it motivates us because we all get to celebrate those successes together. And I think that that's amazing.
Yeah. So, what kind of advice would you give to a student who is potentially listening and is going to have a skilled nursing for a clinical experience coming up, maybe this fall? Like, what kind of
Mhm.
advice would you give them?
I would say go into it completely open-minded. Just know that everything is an opportunity, even the things you think you're not going to learn from someone. And I think it's also what you said: be open to personalities and delivery types. Your instructor or other therapists within that team may not deliver interventions like you would have, but you can learn so much from their approach, and just learning to read the room, read personalities, and apply for what that patient needs you today for, because you don't always get that challenge, in all settings. But I think that just being open minded, not only to the setting, but to different approaches, is entirely important to your success.
How about somebody who's going to start looking for a job soon? Because I mean, let's just think about your student program. I mean,
Mhm.
I think and I hope that some of the students choose to continue to work for your company once they're done.
Absolutely.
That they say this is a great company. They have great initiatives. They're doing wonderful things with their patients, and they choose to stay. Right.
Hmm.
But there might be some who choose to move on or go somewhere else, and that happens too. But what
Hmm.
kind of advice would you give somebody when they're starting out and looking for a career? Right now, students will be testing. It's June now. So in
Hmm.
less than a month, PTA students are going to be taking their NPTE and they're going to be looking for a job.
Absolutely. I think it's very important, one, to get engaged with an organization that can guide you through the process and have mentors. Mentors are very important, whether you go back to your clinical instructor and talk to them about different job offers. I think the one thing that school sometimes doesn't well prepare us for is interview processes.
Mm-hmm.
Right. So, having some talking points and talking to a mentor about what your strengths and weaknesses are, and being honest about those and going into an interview and telling a director of rehab what it is that you're looking for. And never be afraid to say, if you don't have something full time, I'd consider PRN work, right? Because that's what always opens the door into something else. And you're so right. We've converted almost 10 students now to full-time or part-time positions with us. They stay on PRN or whatever it is. So they do come on with us a lot of times. And then if something comes available because someone relocates or whatever the reason may be, retirement, we're in a sector now where a lot of therapists are getting ready
Yeah.
for
Mhm.
retirement. So we're always looking for that avenue to bring them in. So I would say don't be afraid to apply for something and just go for the interview. Go for the interview, meet the team, ask your mentors about the community and the outreach and the organization. Do your homework. I think that that's important to know what your strengths and weaknesses are, and what you can bring to the organization. I'm always excited when a student or a applicant can tell me what they can bring to the organization or what they're looking for, because then I know how to help them through their career path and prevent that burnout and make sure they're successful.
Yeah, that's some great advice there. I like the honest strengths and weaknesses. I think it's so easy for us to kind of take feedback wrong, so it's so
Mhm.
easy for us to look at that feedback and go, "Oh man, there's so many things that I don't do well," but really taking an honest look at our strengths and weaknesses. And I always recommend to students, I'm like, don't just wait for your CI to give you feedback. Do your own self-assessment as well. You should be self-assessing the entire time you're in your clinical experiences. After you exit your clinical experiences, that's the importance of yearly evaluations, right? But
Yes.
I hope we're self-assessing more than once a year, but I
Mhm.
mean, that's such a vital part of it. I mean, we all have our strengths and we all have our weaknesses, and that's really going to kind of point us in the direction of where we should be going for our career if we pay attention to those things.
Yeah, absolutely.
Yeah. So, talking more about mentorship, because we haven't talked enough about mentorship, but in taking advice and things like that, is there a piece of advice that you found that was just super helpful to you that maybe somebody has given you before and that you've just kind of run with it?
I think be curious, right? I think it's incredibly easy to get into a rut in this career and just kind of get into a routine wherever that setting is that you fall, and you don't really challenge yourself. You don't really go for any more certifications. You're happy status quo, or you're building something outside of your career like a family and things like that. I would think just be curious. Every opportunity has its benefits, and not all of them are exactly for you, right? But be curious and have conversations. Don't ever be afraid to entertain someone like yourself who reaches out on LinkedIn. I think that those are the important things, because they've led me to so many opportunities that I wasn't looking for a change, or I wasn't looking to do something different. But when it opportunity presents itself, I'm open minded about it. So I think just being curious and engaging with them, and even if it doesn't work out what they're asking of me or wanting to do, that connection is established, and I can use that future for networking. So be curious and networking. Those are my two big things, because LinkedIn is huge. Don't be afraid to be engaged on multiple platforms, multiple different
Mhm.
organizations, because I can definitely say that my career has been led through just the ability to have other people refer me for things, speak my name when
Mhm.
I'm not in the room. I think that
Mhm.
that's a huge deal. When people know you have integrity and you're passionate about what you do, they'll speak for you when you're not there and lay the groundwork.
Yeah, that's great advice. You mentioned be curious as one of the
Mhm.
things that some of the best advice that you've ever been given. And I do say that, maybe not in those words, but I say that a lot on this podcast, is that if somebody comes to you and says, "Hey, there's this opportunity," just be curious about it. Just think about it and consider it. And you don't have to say yes to everything that comes your way. But especially if you're starting to like branch out a little bit, be curious enough to ask more questions. Like when I reached out to you, you were like, "Yeah, sure, let's talk." And so we had a conversation
Mhm.
before you like just jumped on here today. So definitely kind of explore those opportunities, because usually when somebody says, "Hey, I think you should try this," they're seeing something in you that you
Mhm.
don't necessarily see yourself. So at least give it some consideration. And I always say I'm genuinely curious. So I like to ask that kind of question to somebody, because most of the time I don't know the answer, or I don't have a good knowledge of the answer. And so I genuinely want to know somebody else's opinion about something, because
Absolutely.
that's how I learn.
Mhm.
I don't know this much about it. I mean, I'm lucky that I have this podcast where I can bring really smart people on like you, and then I can just ask you a bunch of questions, because I don't have that knowledge. I'm not a director of therapy. I don't know all of those ins and outs, and I don't know all of those paths. And you've just enlightened all of us
Thanks.
with all of your good advice and information. What do you think? How do you think we can do a better job of taking mentorship? As far as like, if you're mentoring me and you give me all this advice and then I go and do my own thing, like what does that look like? How can we do a better job of really accepting that and considering that information?
Sure. I think that at this point, social media is a big thing, right? And we're always apt to just have a response right then or have an opinion about
Yeah.
everything. But I think if you can take feedback and really study it, take notes when someone gives you something good or bad, whether that's just through a conversation or annual review or compliment, even, and then investigate that a little bit. Again, be curious about what led them to say that to you, and self-reflection I think is a big deal on that. I think that's the key to it, right? Is having the ability to self-reflect and then not always form what you think is the opinion or close doors necessarily, close your mind to things, because it's important that you stay open-minded to it, because you don't know what that leads to for sure.
Be genuinely curious, right?
Yeah.
Speaking of genuinely curious, we did talk a little bit about degrees and certifications. So you and
Mm-hmm.
I, neither one of us pursued a DPT,
Mm-hmm.
but we both have non-traditional roles, right? So you're in a non-linear path. I am in education, which is I probably more linear, I guess, maybe. I don't know. But still, I never went on to get my DPT. I
Mm-hmm.
don't have the desire to do it. I'm not going to do it at this point in time. Now, I could potentially go and get my EDD or my PhD if I wanted to, but I've already decided and determined a long time ago that I liked being a PTA. That's what it was for me. No, I have enhanced my career with a lot of different trainings and certifications and things like that. What do you think that it's a requirement for PTAs to seek out additional school for different leadership positions or for sustainability?
I don't think it's necessary. I think that you have to know the organization that you're working for and what they require if you're looking to move up, right? You have to have honest conversations with your leaders about what that looks like and what their requirements are. But I think just being open minded to the possibilities that are sometimes, like you said, sometimes it's not up, it's linear. Right. And don't be afraid to seek out that role that maybe this is not, I want to get over here, but to get there, I've got to go over here first, or
Mhm.
this will open another opportunity for me to get back to this. So I think I'm always open to those types of things. Maybe the non-traditional approach is a little bit more fun for me. But I definitely don't think that it's always required. I've been successful without having to go back to school. I did, before Hurricane Michael in 2018, re-enroll, and I was like, I'm going to go back for my DPT. So I did everything but my last math class to get back to finishing an associate's and go into a bachelor's for healthcare administration. And then I just saw my career took off for regional positions. And I'm like, I really don't have time to go finish that, nor do I need it. So I'm going to invest in this, that I'm learning more from mentors and actively working in the industry than I am to go sit in a classroom and get a piece of paper for it. And that's what it
Understood.
came down to for me.
Yeah, understood. Do you think in general that we need to change the degree for PTA? This is like a hot button topic issue,
Mm-hmm.
and I'm putting you in the hot seat. I did not tell you in advance I was going to grill you on this, but I
Mm-hmm.
mean, it is a conversation that comes up quite frequently on this podcast, and people have a lot of different opinions on that. So,
Mm-hmm.
what is your opinion on this?
It's hard, right? Because it's hard for me to sit back and know that a DPT became a master's, but an OT hasn't necessarily become a requirement for their doctorate in speech the same way, right? So I want to be careful because I don't want to offend the DPTs out there who
Of
have
course,
gone and
yeah.
did that
Mhm.
hard work for that. But I don't think that it's necessary if you're just going to stay in a clinical role as a PTA. I think if you get into more diverse types of critical care and things like that, it may be necessary, but I don't think that there's anything that I didn't learn in school or that I came out with that I couldn't have developed with clinical
Mm,
mentorship and active work that would have
yeah,
been different for my degree, unfortunately.
yeah. Yeah, I mean, and I think that there's a lot of conversation about what happens in the future with the PTA as far as
Mm-hmm.
like, does our degree change? Do we go
Mm-hmm.
to a bachelor's degree? Do we have multi-entry into the field where there could be an associate's and there could be a bachelor's degree? I myself wonder if PTAs could really fill some of those gaps that we're going to see here in the future for PTs.
Mm-hmm.
Maybe there is a great pathway for PTAs to complete their degree and become a doctor of physical therapy, or maybe not, and they become a physical therapist. Like is there any like middle ground there that we see in the
Mm-hmm.
future? But anyways, that's a discussion for another day, of course. But I
For
was
sure.
just curious where you felt like we were landing on that part. So
Mm-hmm.
so how do you keep yourself motivated and aligned. Because I listed a whole slew of things that you do at the beginning, and I'm going back here to like look and see what it was like. Okay, staffing initiatives, metrics, regional leaders, compliance. Like this is a lot. Like you're doing all kinds of stuff. The student program, you got your hands into that as well. So like, what do you do to kind of keep yourself grounded?
A lot of alone time. I think reading is my quiet time. The phone is right here, but it's flipped upside down on purpose and it's silenced, right? Because we all have to have focus periods. So I think having a
Mm,
focus period during my day, I'm a big advocate for move your body first. This year's transition going from traveling so much to working from home more and being stationary as a DOT means that I wasn't moving as much as I was before. So it's very important for me to have, a gym workout in the morning, good physical movement for my mind. I find that my I work better if my body moves first and then my mind. So I'm
mhm.
a big proponent for that. And then having block out quiet periods where I have focus periods. I have a to-do list. I need to go, not necessarily offline, but I need to go quiet for a few minutes and focus on getting some tasks done so that other people can do their jobs successfully. Because I don't
Mm.
want to let anyone down on that. And then at the end of the day, re-engaging for the things that I love: my husband, my family, nieces and nephews, sports. Love MLB baseball. It's my season right now.
Yeah, yeah.
And then beach time. I live very close to the beach, so just getting outside and getting some quiet time and re-engaging with family have been a big support for me.
I love it. That's great advice. It's definitely something I struggle with is
Mm-hmm.
that carving out time where there's nothing else going on. And,
Mm-hmm.
of course, you and I are in very different seasons and places in our lives and things. And, before we even started, I said, I got to tell my son to be quiet. So he's like, hold on, give
Yep.
me a minute. So that's definitely the season of life that I'm in right now is the one where my kids are teenage boys are in and out and they're loud and making all kinds of noise and things like that. And sometimes I feel like there is no downtime. But if you just carve that out and just make it happen, like you said, you're making time that you work out every morning, and that's what makes you feel good. Finding that thing that really kind of helps pull you back in and keep you grounded, and that's important. I think that we forget to do that a lot, especially when we just keep going. We just get in our routines, and it makes it more difficult to kind of just push ourselves in that direction. But if
Mm-hmm.
you start the habit, it'll stick. You just got to keep with it every day, a little bit at a time. Even
Absolutely.
if it's just for a short period of time. I found that too. Like if I only have 5 minutes and then I can build on that, maybe it becomes 10 and then maybe it becomes
Mm-hmm.
15. But just starting out with that little bit.
Yeah, for sure. And
So
not
now
being
there's
afraid to say no. Right.
what's that?
I said not being afraid to say no. You can't do everything.
Oh,
And I
that's
think that
big.
that's a big proponent of it too, is setting
Yeah.
healthy boundaries and knowing what you can give in a day and what you can't, and not being afraid to turn it off and say, I did my best today, but tomorrow I'll pick up and do this instead. And then sometimes the answer is just, no, I can't get to that. I'm sorry. Thanks for thinking of me. Or I'll do my best next time to align for what your needs are. But sometimes the answer has to be no.
Yeah. No, that's great advice. No is a complete sentence.
That part.
Yes. So I'm sure that you deal with a lot of different personalities, a lot of different people, personalities, backgrounds, all kinds of stuff. So how do you find it best to kind of manage that or handle people who maybe are very different than you, have very different personalities? And I guess in some cases people would say difficult personalities, but
Mhm.
what's a good way for us to kind of remember that dealing with humans?
Yeah, I think that the industry, when you focus on delivering care, but also being personable, right? Not only for our patients, but for our fellow staff and being relatable. I think I always ask myself if I'm seeing someone or I'm having to have a serious conversation about an adverse event or maybe annual review time where you want to bring some things up that weren't as successful as we would like, we're not hitting something benchmark wise. What does that look like? But I think for a serious take, I'm always asking myself, where are they coming from? And asking them, what are your barriers? What are your burdens? What led you to this decision? What makes you have that perspective? Again, being curious about it and asking them, because you'd be surprised what someone will tell you that you're like, I did not see that coming, or I did not see it from that vantage point, and letting them just explain that to you, I think has been critical, because then I can relate. I can build off of that. If I know exactly where they are, I can build off of that and meet them where they are at, and then still come together to say, this is the commonality that we need to get to. right? So I want that to be a successful conversation, and going forward that you and I can have a difference in personalities, backgrounds, cultures, origin, whatever that is, opinions. Try to leave politics out of it. That's always good advice. Leave all politics out of it, right?
Right. Yeah.
But what do we have in common? And if I can find a common thread, or just connect
Mhm.
and, in any way understand where they're coming from first, if you give people the opportunity to express themselves and why they feel that way, they're so much more open to the feedback that you have to give them.
Yeah, absolutely. So, kind of attached to that theme that we're just talking about with your unique roles that you have, what would you say is something that's maybe misunderstood about the type of role that you have? Because, yeah, somebody who's listening to this right now who's like, you know what, I've been thinking about a career change. I think this would, be something I would like to look into, is some type of director of rehab, director of therapy, kind of moving up that ladder per se. But what do you think is like a misconception or something that people maybe don't fully understand about this type of work?
I would say that it is so multifaceted at both the DOR level, the regional, the director, VP, all those linears. It is so multifaceted, and that you have to be able to communicate on a level that PTA school doesn't teach you. I say to students and my staff all the time that they teach you how to be a clinician, not a manager. Right. So
Yeah.
we have talked a lot today about, like, the question you just asked about difficult personalities. Nobody taught me in school how to manage people, and we're people taking care of people. We're humans who have to sometimes check our own personal needs at the door and deliver the care that's needed for our patients, while we know that we have a myriad of other things going on with, whether it's the kids in the background like you had earlier, or my husband who came home a few minutes ago for a PB&J sandwich for lunch, things like that. Being able and just open to be self-reflective to that, I think, are super important, and something that people don't necessarily understand, that my role is compliance. My role is also leading a medical review team and reviewing billing and things that were sent back from CMS.
Mhm.
Do we have patient and staff complaints at the facility level? We have annual surveys going on. We have complaint surveys going on. And then there's the metrics, the bare bones of the business, and answering to those benchmarks, and those people above me too. So it's multifaceted, but I think that people think, oh, it's just making schedules for a director and staffing, and then going to a couple of meetings, right? But it's so much more. The umbrella is so big.
Yeah, I mean, you work from home. How hard can it be, right?
Right? Yeah, for sure.
Definitely things that you have to take into consideration. I think that that's also what I've learned about going into PTA education after being in the clinic is, again, we're not taught to do these kind of things, right? Well, that's because
Hmm.
we're graduating as generalists to work with the human population. We're not
Hmm.
teaching students to be a director of therapy or to be an educator in the future.
Hmm.
But those are the things that, you don't necessarily see until you cross over to that other side. And then you recognize that it has its own set of challenges. So, if you're in the clinic and you're really desiring for a change, really take the time to, again, get in that close proximity to people who are doing the thing that you might potentially want to do, because they're probably going to give you some of those nitty gritty details about the job that you need to decide, like, is this something I can live with, or is this something I don't want to live with? Because
Absolutely.
there's always going to be those pieces and parts of our job that we
Hmm.
don't love as much as the other parts of our job, right?
Hmm.
Like working with students, I love being in the classroom.
Hmm.
But, clinical placements, they get hard from time to time. There's times where I'm really scratching my head and onboarding is not always fun and, all of these different things. But, so it could sound like it's an amazing job. Same thing with like working with pediatrics. I always tell students this as well. And since you kind of have that peds background and love that, yeah, it sounds really fun to play games all day long, but man, you're crawling on the floor. You're dirty when you get home. You're exhausted. You see some really bad things, So, like, there are these pieces and parts that go along with any job that
Hmm.
you really kind of have to get yourself close to it and really kind of dig in and ask some of those questions.
Yeah, and I think don't be afraid to shadow someone. Go along with them for the
Mm.
day. Ask them, can you do that? If you have that opportunity, I would encourage you to do that, even if it's a setting that you're really not considering, because it may open an avenue or a thought process that you could come back to later, that leads you down something you didn't expect. And those are always the fun things in life, the things you didn't expect.
Yeah, definitely. So, do you have any examples of maybe other PTAs that you've worked with that are non-traditional kind of careers?
Sure. So, not necessarily right now in my current position, but I've worked with PTAs who I have a CODA right now on my medical review team. So, linear, right? She's on our medical review team. So, she looks at our audits and billing and CMS guidelines and keeping up to date with those things. And that's a whole nother, that could be an hour podcast as well. I learn from
Wow,
her all the
yeah.
time. Her name is Lori Weimer. So, she is someone who, has been great at mentorship and just sought out other opportunities. So I think the clinical and the billing side of things are something that we're very limited exposure in school, and we sure don't get it
Mhm.
if we just come out and become a clinician. We have to empower ourselves with the knowledge to grow and seek out those opportunities to learn about why we build the codes that we do and how does that relate to reimbursement, and how does that affect the raise that you and I get every year.
Mm. Mhm.
Certain settings require that you bill so many different units per day, and if you're not successful with that, that's going to hinder your progress and growth and financially. So just being aware of those things and how it all intertwines, and then the balance of business too. So I think medical review is a great one. Compliance is a huge one. Getting a compliance certification. We're seeing a rise also in technology advancement, AI, those types of things. I think across the culture, I saw someone the other day that said she was a PTA and she's gotten into tech now, working on EMR and documentation delivery. She works for a software company who developed a documentation system, and now she pushes that out in clinics, whether it be ALF, ILF, outpatient, all those types of clinics. She's found her passion in for documentation in AI and billing and EMR software. So I think those are really cool things that I would have never considered.
Yeah, definitely. Um, I like what your point about billing and compliance, but really any of those things. I always tell students, because do we practice billing in the classroom? Yeah,
Mm-hmm.
but it's on a paper patient or a video that
Mm-hmm.
we're watching of a patient or a um, pretend individual that or somebody who's pretending like they're a patient or something like that. So yeah, we practice with billing, but it's this is the value of clinical education. And if my students hear me say this all the time. I always say that this is the value of clinical education. These are the things that I cannot show you. I cannot teach you.
Mm-hmm.
I mean, I can try, but us playing around with a paper patient and billing on a piece of paper or in a fake EMR system isn't really going to show you what it's like in a clinical setting.
Right.
That is the value of clinical education. That's why we seek out amazing partners like Step Up to take students that can train them in these things because it's just not the same. You get
Right.
yourself in that environment where you have your patient in front of you and you got to make decisions and you're looking at the time and you're trying to figure out what this is. That's something that we just can't really make that connection in the classroom. We need that clinical environment.
Absolutely.
Yeah, great. So, what is your vision of where the excuse me, where is your I'm going to start over. What is
Good.
your vision of where the PTA is going in our profession in the future? Like how do you see this PTA in the next 10, 15, 20 years?
I do think, like you said earlier, we're going to have to fill some of those gaps for PT, right? And not to take
Mhm.
away from their value and their education, but what can we take as clinicians after years of experience to really be meaningful for our patients? And not being afraid to ask those hard questions in front of APTA and some of our other organizations and advocacy for our industry as a whole. I am now involved more than I've ever. Like I never thought that I would go to Tallahassee to the Capitol and advocate, but I got a chance to do that last year and talk to them about how our decision making things that we're doing at the Medicaid level and Medicare access to care and those types of things, how they impact us as a therapy team, and our patients and their ability to get care. It's hard when you have all these types of insurances now pushing and determining a length of stay, and so many things are driven by AI that kind of takes the person out of it. So it's good to go and sit with lawmakers. So I think we're going to play a key portion in using our voices because we spend more treatment time with assistants most of the time than an evaluator does. They're doing
Mhm.
top of service billing, they're doing evals, they're doing research, discharge summaries, but we're providing the clinical care a lot of the time. So what can we do to fill those gaps? And then how can we advocate for ourselves to grow beyond just an acronym for sure?
Yeah, definitely. Advocacy is important. I talk about it on the show a lot, and
Mhm.
I've brought people on to talk about it, and it's something that I hope that, and I wish that everybody would take the opportunity to just try it. It can
Mhm.
look very different. Advocacy doesn't have to mean going to Tallahassee, right? It
Mhm.
can, but it could also be writing a letter. It could be making a phone
Mhm.
call. So advocacy can be very big, it can be very little, but it can be very powerful if we would
Mhm.
all take our part and do something with advocacy, right?
Mhm. Absolutely. I think it's just empowering people to know what the avenues are. If you're naturally introverted, like you said, you don't have to go to Tallahassee and talk to lawmakers. You can write a letter. There are so many different divisions out there that will allow you the letter, and you just plug and play, right? Put your personal opinion in
Mm,
there, put your stories, put something relatable. It can be that easy to send an email or, like you said, make a phone call. But then there's sometimes that visits are really important too, and we get that opportunity.
great. Well, it is starting to storm incredibly hard here at my house, so I'm hoping that my internet doesn't go out. But
Okay.
before we wrap things up here with this episode, I would love it if you would give our audience your plus point. So this is any words of advice, any I don't know, call to action. Do you want to start a fire under anybody? It's your platform. You go right ahead.
I think I would say to our PTAs, don't be afraid to invest in the future of other PTAs. This is not a competition. We all grow
Mhm.
together. We need to empower students to want one to enroll in programs, right? Not everybody can go and be a DPT. Not everybody can
Mhm.
go and be a manager. But what can you do at your clinical role to empower our industry that we stay relative and important?
Mhm.
And it is about that clinical care at the end of the day. So just challenge you to get outside of your little box, whether it's advocacy, whether it's being a clinical instructor, whether it's seeking out management and mentorship. I think we all have something to offer, and it would be much more rewarding if we went in with that little bit of extra every day and gave it our best. We'd all feel better about it for sure.
Couldn't have said it better myself. Wonderful words of advice and a great plus point. I appreciate your time. Thank you
Likewise.
so much for saying yes to an opportunity, and not being afraid to explore that opportunity, just like we've already talked about today. Just making sure that we stay curious and just ask lots of questions. So you've kind of hit all of the points that I try to make very clear on this show is that we are more than our title, and it doesn't always require us moving on. It might require us moving on, but it doesn't have to. There's lots of different ways we can go.
For sure. Thank you for the time. I appreciate it.
Absolutely. Have a good day.
You too. Bye.
Thanks for listening to PTA Plus, the podcast for PTAs by PTAs. Subscribe, follow us on social, and share the show. Elevate yourself. This show is for educational purposes only. No clinical decision making should be made from its content. See you next time.